Ever thought about what a silent killer might look like? It's not what you might imagine. It could be something as common as colon cancer. Colon cancer, often lurking in the shadows, undetected until it's too late, has indeed earned its moniker as a silent killer. It's a term that might sound dramatic, but it's tragically accurate. This insidious disease often begins as non-threatening, barely noticeable symptoms that many of us might dismiss as everyday discomforts or minor health issues. But this is where the danger lies, because it's in these seemingly insignificant signs that colon cancer starts its stealthy invasion, quietly turning our bodies into battlegrounds. As it advances, it becomes more difficult to treat, reinforcing its silent killer status. Understanding the early warning signs and symptoms of colon cancer is crucial in combating this silent killer. It's not about creating fear, but fostering awareness and promoting early detection. So let's delve into the world of colon cancer and unmask this silent killer. Firstly, understanding the early warning signs of colon cancer is essential in detecting the disease at an early stage. One of the most common signs of colon cancer is a change in bowel habits. This could mean anything from diarrhea to constipation, or a change in the consistency of your stool that lasts longer than 4 weeks. It's important not to brush these changes off as just a stomach bug or a result of something you ate. If they persist, it's crucial to consult a healthcare provider. Another early warning sign to look out for is the presence of blood in your stool. The blood may be bright red, or it could present as a darker color, almost black. While this could be caused by less serious conditions like hemorrhoids, it could also be an indication of colon cancer. Abdominal discomfort is another symptom that should not be ignored. This can manifest as cramps, gas, or pain that persists. It's easy to dismiss these as common digestive troubles, but if they're happening more frequently, it's worth getting checked out. Unexplained weight loss is also a potential red flag. If you're losing weight without trying, particularly if it's accompanied by other symptoms, it could be a sign of colon cancer. This is because the cancer can affect your body's ability to absorb nutrients. Lastly, persistent fatigue can be a sign of colon cancer. It's not the kind of tiredness that goes away after a good night's sleep. It's a deep-seated exhaustion that doesn't get better with rest. This can be due to the cancer cells using up your body's energy, or from the loss of blood that can occur with colon cancer. In conclusion, changes in bowel habits, blood in stool, abdominal discomfort, unexplained weight loss, and fatigue are all early warning signs of colon cancer. It's important to remember that these symptoms can also be caused by other, less serious conditions. Therefore, experiencing one or more of these symptoms doesn't necessarily mean you have colon cancer. Remember, these signs are subtle, and that's why colon cancer is often referred to as the silent killer. Now that we've covered the early warning signs, let's explore the symptoms of colon cancer. As we delve into this topic, remember that these symptoms often surface when the disease has moved into a more advanced stage. Firstly, severe abdominal pain is a common symptom. This isn't a fleeting discomfort that follows a heavy meal. We're talking about persistent, intense pain that doesn't subside and can't be easily explained. It's a sort of pain that interferes with your daily routine and significantly reduces your quality of life. Next, there's the presence of a noticeable lump in the abdomen. This lump, often felt during a physical examination, is typically firm and unmovable. It's important to note that not every abdominal lump is indicative of colon cancer. They can result from a variety of health conditions. However, any identified lump should be immediately reported to a healthcare professional for further investigation. Lastly, let's discuss iron deficiency anemia. This type of anemia occurs when your body lacks enough iron to produce the hemoglobin it needs to carry oxygen in your blood. Symptoms of iron deficiency anemia can include extreme fatigue, weakness, pale skin, chest pain, cold hands and feet, and shortness of breath. When colon cancer is the cause of this anemia, it's usually because a tumor has been bleeding slowly over time, leading to this iron deficiency. Remember, these symptoms don't confirm a diagnosis of colon cancer on their own. They are, however, serious signs that something isn't right in your body. If you experience any of these symptoms, it's crucial to seek medical attention promptly. A healthcare professional can provide the necessary tests to determine the cause and appropriate treatment. It's also important to remember that early detection is key in the battle against colon cancer. Regular screenings can catch this disease in its initial stages, even before symptoms become apparent. These symptoms are more severe, and by the time they appear, the disease might have already progressed significantly. So, let's not wait for them to show up. Instead, let's stay proactive about our health. You might be wondering, why all this emphasis on early detection? Well, let's delve into that. When it comes to colon cancer, or any cancer for that matter, early detection is the key to successful treatment. It's like finding a small leak in your home. If you catch it early, you can fix it with minimal damage. But if left unnoticed, it can lead to significant damage that's much harder and much more expensive to repair. In the context of colon cancer, early detection can significantly improve survival rates. In fact, when colon cancer is detected and treated in its earliest stages, the 5-year survival rate is about 90%. That's right, 90%. So it's not just about detecting cancer early, it's about giving you the best possible chance of beating it. This is why regular screenings are so crucial. They can catch potential issues before they become major problems. Remember, in the battle against this silent killer, early detection is our most powerful weapon. So, we've unmasked the silent killer and understood its early warning signs and symptoms. We've journeyed through the complexities of colon cancer, unraveled its indicators, and learned about its symptoms. The signs may be subtle, the symptoms might be confused for something less malign, but now you know what to look for. Unexplained weight loss, persistent abdominal discomfort, changes in bowel habits, or blood in your stool. These are just a few signs that should not be taken lightly. Screening is crucial, and it's a powerful tool in our fight against this disease. It's not just for those who have symptoms, but for everyone. Regular screenings can detect colon cancer in its early stages, when treatment is most effective. If you notice any signs or symptoms, don't hesitate to seek medical advice. Remember, the key to defeating this silent killer lies in your hands. Stay vigilant, get screened, and let's no longer allow colon cancer to silently wreak havoc. To stay informed and to continue learning about important health issues like this, be sure to our channel. Your subscription will allow you to have access to more informative videos that could potentially save a life. Do your part in the fight against colon cancer and hit that subscribe button now.